After Baba Ramdev claimed that they had discovered a medicine to beat the novel coronavirus or COVID-19, the Ministry of Ayush has taken cognizance of their claim. Ayush Minister Shripad Naik spoke to NewsX and said that the ministry has sought a report from Patanjali. The ministry also stated that Patanjali has been informed that advertisements of such drugs are regulate, and Patanjali has been asked to provide details of the drug. This includes name and composition of the medicine and where the research was conducted for COVID-19, along with protocol, sample size, ethics committee clearance, as well as the CTRI registration and results data of the study. The question remains if there will be certain checks and balances which will be put in place before such announcements are made. We'll talk about this, that if something is really good at curing COVID-19 in 7 days, why wasn't its development or the work related to it told to the government or to the people or to the ICMR or to the other agencies who've been grappling and struggling, trying to look for some solution as to how to rid patients of COVID-19? We'll talk with the prominent guests on the panel. And we are also joined by Dr. D.K. Gupta, CMD of Felix Hospital. Dr. Gupta, if you can hear me, sir. Dr. Gupta, if you can hear me, sir.
Yeah, please.
Right. Dr. Gupta, what was your first reaction on hearing that a cure has been developed by Patanjali? Obviously, the research and development aspect of a company is extremely important. There have been some accusations pertaining to Patanjali in the past as well when it comes to their research and development facilities.
Yes, the first reaction was that it looks like unbelievable to have a drug that is very effective, and they are claiming about 100%, not about, they are claiming 100% cure for the corona with 7 days treatment only. We have seen several drugs has been sold and has been developed all across the world, even hydroxychloroquine and other like dexamethasone. There were larger studies in the different countries, and on these studies there were Cochrane studies, means studies over studies. And these studies were in the best of the institute, and there were the involvement of the different departments like virologists, like pathologists, radiologists, chest physicians, and patients of different category, means patients suffering from mild illness or asymptomatic or severe disease, and the results were correlated, and then they were on some conclusion that this drug is effective for mild or moderate cases, and this drug is effective for severe cases, and these few drugs were non-effective also. And therefore, before claiming any 100% cure for any disease, not corona, there should be a study that should not a single study, there should be multiple studies, and sample size should be adequate, and they should have follow all the guidelines of the development or clinical trials. Basically, there are guidelines given by the Government of India, Ministry of Health, even ICMR, even Ayush Mantralaya also.
Right, Dr. Gupta.
Follow all these guidelines.
Dr. Gupta, do you find it hard to believe that such an announcement was made without keeping the proper administrative channels in mind, and this could perhaps even lead to some sort of a misunderstanding between people looking for a cure for corona and Patanjali?
Yes, definitely. I think it was in little hurry that they said that this is not a marketing or branding. It is just the like launching of the drug, and launching itself, it's a marketing strategy. And I think this is a marketing strategy they have basically, they were like doing to promote and to reach the masses without any doing bigger campaigns. And I think they are a little bit successful also, like media and print and electronic media also doing the same, and they're supporting them and not supporting them, but they are promoting the name of the medicine. And now because our population, Indian population, 70% population belongs to the rural areas, and they don't know about the clinical trial, they don't know about the efficacy of drug, they don't know the quality control of drug, they don't know of the safety of the drug. Just they go by the word of mouth, or what media or campaigns or what the authorities or doctors prescribe them. So therefore, it can lead to misunderstanding among the masses. I think therefore government has stopped the banned the drug, and they are banned also the advertising of drug before and they have, I think, started an investigation in the same case, so that they should know what is the exact status and what is the efficacy of the drug, so that it can be launched. Not in India, because this corona is not limited to Indian geography only. It is global disease right now.
Right.
Therefore, this type of news can create misunderstanding among global masses, and it can it can have an effect on our repo
absolutely.
also, Indian repo also.
Absolutely. Dr. Gupta, before we wrap up the show, let me come to you, sir. Obviously, this is a very sensitive area, not only for the people who will be using this medicine, but also for the government, also for the authorities, because anything untoward, anything unexpected, any gaps, could make or break any company for that matter.
Yes, definitely. Therefore, we suggest that there should be a larger studies, there should be larger trials, and these trials should be regulated by the governments and like ICMR or some Ayush guidelines. And after that only, these drugs should be allowed to be come in market, and they should be consumed by the patient, because we know the patient life is very important, and any side effect of these drugs or any no effect of this drug means they have no effect and they are not any helping in the treatment of the COVID disease, then it will be harmful or it will be lethal for the patient. We know that we are fighting against corona right now with few weapons only. We have only few selected drugs like remdesivir, dexamethasone, and few like hydroxychloroquine and a new drug favipiravir. So these are the few drugs which has been approved by FDA and the Indian government only. If we have some drug, Indian drug, Ayurvedic drug, that will go to globe also. That will not be limited to India only. Therefore, before launching, before coming into the market, they should have very good trials, very good studies on the patient.
Right.
Large number of the patients should be involved.
Okay.
Different category of the patients should be involved. Age group, different comorbid conditions, different type of symptoms like mild, moderate, severe symptoms. And after this involvement of the high level of doctors like oncologists, like molecular biologists, like virologists, pathologists, radiologists, and they should be combined. Like they have involved the doctors from the name, but they were only physicians. There were not chest physicians. There were no pathologists. There was no biochemists. These all doctors should be involved, and they should make a conclusion after having a big trial. Then we can do something on that.
A lot of things to be ascertained before people can definitely verifiably say that this medicine actually works. Nevertheless, it's a step in the right direction.